So we're going to try something different here at Healthcare Triage News. We're going to try to make it more newsy, especially with the changes being proposed every week to the US healthcare system. It's going to be our chance to tell you what's happened, what's going on, what you need to know. This will require some changes on our part, and it might even move the day of the episode release. We'll keep you informed as we go. This is Healthcare Triage News. We picked an interesting week to start this experiment because Congress is on vacation, and therefore there's not as much news as usual. But let's catch you up to what's happened right before they took a break. The Senate really wanted to get their bill, the Better Care Reconciliation Act, or BCRA, passed before they left. After developing the law behind closed doors in secret, they released it to the public on June 22nd. It aimed to repeal pretty much all of the ACA taxes and revenue generators. It would also repeal the employer penalty and the individual mandate retroactively to 2016. The biggest changes are planned for Medicaid, though. The bill proposes deep spending cuts, arguably even more long-term cuts than the House's AHCA. Because while they kick in later, they'd be bigger over time. Like the AHCA, this bill would raise the age bands from 3-to-1 to 5-to-1. This would make insurance cost much more for older people and less for younger people. Days later, on June 26th, the CBO released their official score of the bill. It was not pretty. They projected that about 22 million more people would be uninsured in 2026 than if we just left the ACA alone. By just next year, about 15 million more people would be uninsured if it went into effect. In addition, premiums and out-of-pocket expenses would go up significantly right away, because mostly healthy people would exit the market, leaving sicker people driving up costs. The good news, I suppose, is that the bill is projected to reduce the federal deficit by $321 billion over a decade. More detailed analyses showed that premiums for older people would go up a lot. This law seems designed to reset the standard to a bronze plan, not a silver one, so let's discuss that. Under the ACA, a 64-year-old making $26,500 a year, which is 175% of the federal poverty line, would see a premium of $0. Under the BCRA, it would go up to $2,000. The kicker is for the guy making $56,800 though. That's about 375% of the poverty line. Under the ACA, his premium will be $4,400 a year. Under the BCRA, it goes up to $16,000. And since we're talking about bronze plans, that's before the likely $6,000 deductible. And that deductible applies to everyone, even people with an income around the poverty line who would have to buy insurance in the exchanges. The premiums might be small, and there do appear to be premiums, but with a $6,000 deductible, no one would buy the plan. Don't take my word for it, let's listen to the CBO. The deductible for a plan with an actuarial value of 58% would be a significantly higher percentage of income, also making such a plan unattractive, but for a different reason. As a result, despite being eligible for premium tax credits, few low-income people would purchase any plan, CBO and JCT estimate. In other words, insurance will cost too much for the poor to use, even if they could afford it. So we've got a bill that massively reduces future Medicaid spending, reduces subsidies in the exchanges, removes the penalties and mandates, repeals many ACA taxes and fees, and shifts some money to states and insurers to help. Compared to the AHCA, this bill actually cuts Medicaid less in the 10-year window, cuts subsidies less, and repeals fewer taxes. So it has more deficit savings. Still, it's hugely unpopular. So much so that the Senate couldn't even move the bill forward to a vote before the recess, which is what Republicans wanted. The president tried to tweet a repeal now, replace later strategy, but given his strong opposition to that before, it doesn't seem likely to happen. We had a whole episode on repeal and then replace, for instance. Go watch it. The Senate is also floating two proposals to the CBO right now. One would create separate markets for people with pre-existing conditions and also would have essential health benefits. The other, not so much. It's not even clear that the Senate rules would allow such a plan through reconciliation, but we look forward to a CBO report on it regardless in the future. And senators are home right now, getting an earful from the many people who oppose this bill. It has an incredibly low level of support. But Republicans in the House, Senate, and even the White House want to win. It's unclear they're going to get one, but as news develops, we'll have it here on Healthcare Triage News. Healthcare Triage is funded in part by viewers like you through Patreon, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank Joe Sevitz and Sam. Thanks, Joe. Thanks, Sam. More information can be found at patreon.com/healthcaretriage.